Hello, everyone, and good evening. Welcome to tonight's event. On behalf of Dr. Ann Kurth, the president of the New York Academy of Medicine, our nursing section officers, Dr. Allison Squires and Dr. Maria Vizina, I welcome you to our 6th annual Health Informatics Conference in collaboration with the New York Academy of Medicine. Our topic this evening is artificial intelligence in healthcare, challenges and opportunities. Before we begin, I just wanted to make this group aware of a very exciting event that the New York Academy of Medicine is hosting on this Monday, February 26th. This is an all-day symposium from 8:30 to 5 p.m., and it's focused on building a more resilient health system in the face of climate change and other stressors. Notable speakers include the president and CEO of the Joint Commission Enterprise, Jonathan Perlin, Liz Grant from the University of Edinburgh, Ashwin Vasan, the New York City Department of Health Commissioner, and many, many more esteemed experts. The goals for the day are to develop a program of work and a community of practice that will help New York health system prepare for the next global pathogen, climate crisis like Hurricane Sandy or wildfires. The event will include keynotes, panels with national and local leaders, and breakout sessions for in-depth discussion and networking. It promises to be an excellent day. Please feel free to use the QR code and scan it for your registration. And without further ado, I'd like to present our esteemed panelists. Maura Grossman is a legal and technological expert who is specializing in e-discovery and AI applications in law, healthcare, and archives. She conducts research, is a consultant, and serves as an expert witness in court cases. Kathleen McGrow is the Global Chief Nursing Informatics Officer at Microsoft. She advises organizations on using technology to improve healthcare delivery, the patient experience, and workforce development. She holds clinical and IT experience. Michael Cary. Michael is tenured nursing professor and a health data scientist. He is focused on AI and machine learning to improve health equity and care delivery for vulnerable populations. He conducts research, he has published widely, and he advocates for fair and ethical uses of AI in healthcare. And I'm happy to introduce our esteemed moderator for this evening, Keith Weiner. Keith is an expert at cybersecurity. He's a researcher and a professor with over 20 years of experience, and I know firsthand he enjoys music and technology. Without further ado, Keith.
Thank you very much. Okay, so thank you very much, Toby, for the wonderful introduction. So my name is Keith Weiner. I'm the chair for the Informatics group. Before we get started, I would just like to say a very personal thank you to our esteemed panelists, our colleagues at the New York Academy of Medicine, and all those who have helped to put this event together. We'd also like to thank Malloy University for their sponsorship. And so for those nurses who need continuing education credit, you must stay for the entirety of the event and submit feedback. We will be providing you a feedback form, and you should submit that within the week. CEs are provided by Malloy University as approved by the New Jersey State Nursing Association. So most importantly, I would like to thank the audience for your participation. Please feel free to enter your questions for our panelists in the chat. And with that, on with the show. So we have our first question I'm going to address to Michael. So the first question is very near and dear to our hearts here at the New York Academy of Medicine. In what ways can AI in healthcare be leveraged to address health disparities and promote health equity and fairness? So this question goes to Michael first, and then we can go around the Zoom room.
Yeah, thank you for that, Keith. There are a number of ways in which AI can be addressed, can be utilized to address health disparities and promote equity and fairness. Some of the ones that come to mind are the incredible work that is being done in using AI-powered systems to analyze scans for screening, be that of diabetic retinopathy or breast cancer detection in mammograms. With the example of diabetic retinopathy, I think some of these AI systems have the ability to screen prioritized cases for specialist review and optimize resource allocation. I think that's particularly helpful and impactful in regions where there's limited access to ophthalmologists and other types of specialists.
Okay, wonderful, wonderful. Thank you very much for that. And
Sure.
for our other panelists, Maura, Kathleen, would you like to follow? Is anything to follow up with that?
Sure.
Yeah, go ahead, Maura.
Okay. I was going to say it's really critical that we increase awareness in the population of these tools and how they can be used. And it's critically important to get practitioners and users a seat at the table, because the technologists don't know healthcare like you do. They're building often in a bit of a vacuum, and they don't fully appreciate all of the discriminatory impacts or some of the other issues that you may be aware of. So it's really important to get all stakeholders at the table and not just the technologists.
Okay.
Yeah, I agree. I agree with both, obviously, with both Maura and Michael. I think we're of the same mind, but I would say one of the things would be, potentially having the ability to better identify patterns in the data than, we have been able to do in the past, so that we can ensure that we can help equitable diagnosis and treatment of diseases, so that patients would need to have the same access, or their providers would need to have the same access to the AI. We need to work on reducing bias. We know that there can be inherent bias that is built into AI models or AI algorithms. So we need to work on that. I think that's something that we can do a better job at. And we need to ensure that we have, when we're looking at the data, that we have good data that's very diverse versus homogeneous data, right? So we need to have a good variety of data. We need to look at the ability to, how do we improve or allow AI to help patients better access the services that might be available. And are we leveling the playing board, or the playing field, or are we actually making more disparities? So essentially, we have to look at that. I think one example Michael gave around radiology, if you think of like clinical trials, there could potentially better access to clinical trials if we have that AI embedded within clinical trials, and the opportunity to discover what those clinical trials are for a broader brush of patients, rather than just pockets of patients that are maybe located geographically to an area that has that opportunity.
That's fantastic. So jumping off of what you just said about healthcare disparities, and to making sure that we actually don't go in a negative direction. So what ethical issues do our panelists feel that need to be considered when using AI and its underlying data in healthcare? And I see some things coming in the chat about safeguards, but just in general, what are some of the ethical considerations that you can see going forward?
Well, I can go first for this one if folks are okay with that.
Please.
I would say top of mind, the number one thing is around data privacy. How are we ensuring that our PHI is protected? A patient's PHI is protected. How do we ensure that the people that need access to it get the appropriate access? Notice I said that. Like, do they need access to everything, or just specific things? I think that we have to look at transparencies as far as for the providers that are making decisions. Is the AI transparent enough that it's a glass box versus a black box? So I think you brought that up, Keith, right? Clinicians need to understand what goes into the AI modeling, so they have a good understanding of what that potential output would be. And then how do we address or utilize AI in an accountable manner? So we have to ensure that we use it responsibly. We're not just using it because we have it available to us, but we have to use it responsible in ways that matter both to our providers and to our patients. And I'll hand it off to Michael to see if he has anything additional.
Yeah, thanks, Kathleen. So I would add to that is A lot of the times there is bias that creeps within these AI systems because it's trained on data that is biased from the beginning, bias that doesn't have representation of particular groups within these data sets. And when there's not representation of particular groups, the model may not perform equitably across those groups, right? So in those instances, it can perpetuate different disparities or heighten them. So it's very important for us to think about the data that exists, the data that we're using within these models, and whether or not there's representation within those models. I think another thing that should be considered is the just regular auditing of these AI systems. I know at Duke, and I'm sure at other very well-resourced health systems, we have a very large governance infrastructure set up to evaluate all of the AI models that are developed and deployed within our health system. And so we're talking about a team of maybe 10 or 12 different experts with a variety of different backgrounds and skills, from regulation to implementation science to health equity to data scientists. And we all wrestle with and we look for ways of identifying and mitigating bias within algorithms across their life cycle.
Okay, thank you very much for that. Maura?
I'll add two things. One, I want to take a step back. Everybody needs to have internet access, high-speed internet access that actually works, because you can't get telehealth and you can't get many of these applications online if you don't have a decent internet. And we know that there are racial disparities and wealth disparities in that. So that's absolutely critical. The second, and this has already come up in the chat, is we need to make sure, at least initially, until we're very, very comfortable with these tools, that they are not replacing human decision-making. They are supplementing human decision-making. So we're using them as an adjunct to say, well, wait a second, the algorithm thinks the diagnosis is this. Maybe you didn't think of that. Should you reconsider? Or the algorithm is suggesting this person should be triaged first, even though they don't look as perhaps sick as somebody else does. And it should be helping us, not replacing human judgment. It should be a supplement, at least at this point.
So thank you very much for that. So the last thing that you mentioned, I just want to jump off of that because we have two questions came to mind, and actually there seems to be a common theme, a few common themes emerging. One is about ethics and the other one is about workforce. So somebody wrote, what about job security and safety issues when AI takes over? But I'd like to spin that in a little bit of positive way. And two other questions that I saw, which are closely tied together, is how will this help with the workforce shortage, and how will this change, preferably for the better, change the job of healthcare professionals, specifically nurses?
So
anybody who, please.
Go ahead, Maura. I went first last time. You go ahead.
Okay. So point number one, folks, this is not a choice. Tech-savvy health professionals are going to replace the dinosaurs, period. So get with the program and start experimenting with the tools, learning about them in safe environments. We need to introduce this in healthcare curricula. So that's one point. I don't think you're all going to be replaced in the next 3 years. I don't think that's a realistic concern, but those of you who refuse to learn about this stuff are going to be less competitive than other people. As far as paperwork, I think that there is the likelihood that these tools are going to make your jobs much easier. I'm working with some folks in Canada, and we're using large language models for in a rehab center for children to replace these notes that take clinicians forever to write. So we're working with them so that they can bullet point out a few things that they observed, and a large language model can write the note, and then they can spend 2 minutes reviewing and editing the note instead of an hour writing the note. So I think that there are many ways that this will absolutely improve your job. I think the tools that will help with triage will be very helpful. So I wouldn't be as terrified of this as you initially think, you know, you should be, that the bots are coming and they're going to completely replace you. I think that this is going to actually free you up to do things that more important things that actually require human health care and compassion and other skills that are uniquely human.
Yeah.
Wonderful. So the rise of machines, and they're here to help us. So
I don't
yes,
like to hear it that way, Keith. That kind of sounds like critical, like,
tongue in cheek.
Sci-fi. Yeah, yeah. So I look at it as 100% with Maura. It will, be assistive to what we're doing as clinicians. There will never be a robot that's going to come in and hold a patient's hand or touch their forehead when they're dying. My background is shock trauma, so I did that quite a bit as part of my job. Machines cannot show empathy like humans can. I think what machines, including artificial intelligence, can do, it can offload some of the administrative burden and some of these administrative tasks that now nurses have been piled on for years with this, especially around documentation, and allow nurses to work top of license, and other clinicians to work top of license, or allied health professionals to work top of license. Because I don't think it's just nursing. I think it's also, physical therapy, and we're all crushed, right? We're all being crushed, as well as physicians. And I think that really would be the goal, is to allow the reason why I'm where I am as, Global Chief Nursing Information Officer at Microsoft, is that I truly believe, as a large software vendor in the healthcare space, we haven't been able to fix it internally to healthcare. I've been in healthcare for a really long time, that it will take outside disruptors to assist with that. We can't do it without you. The healthcare organizations and the end users need to be there to participate. But the reason why I'm doing what I'm doing is that I believe that technology has we have the opportunity with technology to bring joy back to the practice of medicine and nursing. And that's really what I got a lot of joy out of doing patient care. And I want nurses to get as much joy as I did. But I had practiced for a very long time, and I did not experience that amount of administrative burden that's currently going today. I'll hand it over to Michael.
Yeah, and I'll just add to Maura and Kathleen's point. So healthcare systems, many of them have already entered into multi-million-dollar partnerships with large technology companies for the purposes of utilizing some of these technologies to improve patient care. One of which you may or may not be familiar with is the DAX Copilot, right? Where that's an example of what Maura and Kathleen are talking about, where imagine the clinical encounter being recorded, voice to text, and then going through a quality review, and then that transcript, if you will, or those clinical notes are uploaded into the electronic health record, right? And so in theory, this potential reduction in documentation time means that nurses and other clinicians can increase that time with their patients. And that is, I think, a very positive thing. Now, what comes along with that is a couple of other considerations. What are the skills and the knowledge and the competencies that nurses now have to learn or acquire? Digital literacy, data management, interpretation, collaboration, and ethical and legal considerations. All those things now are particular skill sets that I think that as schools of nursing, I work within the School of Nursing, have to really begin to think about, how do we effectively prepare nurses for this AI-driven environment?
That's a good point, Michael. I'll just pile on Keith really briefly, is that
Perfect.
the majority of organizations I work with their leadership, especially nursing leadership, because there's such a bad workforce crisis, and they do see how can we help our care providers. And a big a big ask that I hear from these organizations leaders, the nursing leaders, is can you help us with literacy, both for ourselves as nurse leaders, because we have a seat at the table. We want to be articulate when we're at the table, and we want to understand the strategy that we're moving forward with the AI. And I, as a nurse, right, the doctors are always brought in right away, and nurses, we tend to get left behind. So we're trying not to be left, they're trying not to be left behind within their organizations. So I think literacy and education is just paramount to what we need to do moving forward. And to Maura's point, it's going to happen to us regardless. So we need to, the plane's already left the airport, we got to jump in the plane. And I think part of it is just even joining this webinar tonight and trying to get more understanding and education on it.
Thank you so much for that. So the chat is actually blowing up, but one common thread that we see is that people are asking for examples, how this may be used in nursing. I think we've already covered some of that, but how is it maybe already being used in nursing? Does anybody want to opine on that?
Well, I mean, not specific to like generative AI, but I'm sorry, Maura, but
Go ahead.
if you even look at like predictive analytics or probability and things like that, the AI is, if you're utilizing clinical decision support, there's modeling, there's machine learning that can be built within that clinical decision support. So you're probably already using it. And if you're using even, if you have a call center within your organization, most likely there is, or a chatbot on your website that in general has some AI that's built into it. So don't just think of, there's many different types of AI. So we have to be cognizant of that. There's computer vision AI. There's a lot of different types of AI. So those are, I just gave, just a couple of examples, and some of them you just have to inquiry within your organization, say, we're doing XYZ. Can you tell me, where are we using AI? Are there pieces that I need to know about? And how do you make that glass box, right? So it's probably a black box right now, and maybe you're not aware of it within your organization, but by asking the appropriate questions, you can learn more about it. Maura, I'm sorry, I didn't mean to step on you.
It's okay. So I think one of the most promising areas we're seeing in health, at least, is drug discovery. That is just going to speed up at an unbelievable rate. I think we're going to move somewhat from diagnosis and treatment after the fact to more successful preventive medicine with these tools. I think that they're, as Kathleen said, going to be able to predict who's at high risk for what. I've been very excited by synthetic health data and being able to, as Michael was saying, when your data is missing certain populations, people of color, certain ages, to be able to create synthetic data that mimics real data so that the experiments are done on more representative samples. I think health apps will increase, and monitoring of elderly and people in remote locations. You'll be able to send them some kind of bot that'll send you back the information so that you don't actually have to travel to them. The information will come to you. I'm very excited about some of the brain-computer interfaces and people being able to get their vision and their movement and their speech back when they don't have it. So I think there are lots and lots of uses that are very promising that we're going to start to see more of, both in health in general and in nursing care.
Wonderful, wonderful. Thank you. And Michael, do you have anything to add in terms of the applicability, either in present or where you see the potential?
Yes. Can you all hear me still?
Perfect.
Screen seems to have frozen. Okay, great. So I think that those are wonderful examples that Maura and Kathleen have given. I think where there's enormous potential as well is enhancing education and training. So, for example, there are huge opportunity for creating virtual simulations and augmented reality for the purposes of providing very realistic and scalable training experiences for nurses and other healthcare professionals in training. As a faculty member, I'm excited about the potential of personalized learning, right? So personalized learning, we know, is ideal and for, based on economics, it's very difficult to kind of personalize learning experiences at the high school level or college level. But we may be at a point now where we can actually tailor educational content using large language models to meet the individual needs of healthcare students. And I think that is extremely exciting.
Well, thank you so much for
Can I
sharing.
can I add
Please.
to that for Michael? So Michael, we actually call that in the when we're talking about generative AI, the example you gave, we call that curation of the content, right? So, and we look at the example that I usually hear is if you have a nurse with 1 year experience or a nurse with 10-year experience and they need educated on a certain topic, maybe they haven't seen a specific dressing change or something in or whatever it might be, that they're, because the content would be curated for that nurse, it would know that, say, the 1 year experienced nurse needs a 5-minute video and the 10-year needs like a 1-minute video, right? So that's kind of just a concrete example of how I've heard what you've described explained in that curation topic.
Yeah. Also, there's been some applications where they put a camera in the emergency room with an AI on it, and it sort of blacks out or blanks out the faces of the staff, both the nurses and the doctors, but the AI can analyze the recording of a surgery and say, you know, it would be much more efficient if you put the crash cart, if you moved it from where it is now to over here, or I noticed, you know, somebody didn't do XYZ that they should have. So I think that these tools, I agree with Michael that the potential for training is, and greater efficiency is phenomenal.
Thank you so much. And some others in the chat have opined on some areas they'd like to see AI make strides in, particularly fall risk, sepsis early warning, and readmission risk. So with that,
Fall risk is a good one, Keith, for computer vision. So
okay.
the model, right, depending on, you know, it's similar to Maura, right? What she just said about the ED, it would be camera in the patient's room. And then the model's been built on many, 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 you know, maybe even thousands or tens of thousands of other video clips of a patient potentially at risk for fall. And then there's a trigger to the nurse to say, you know, there's two things that could happen. One could be it would trigger to the nurse that the patient is trying to get out of bed. And the other would be, there could be a response to the patient saying, you know, to the patient, Mr. Smith, the nurse will be right in, to kind of like trigger that. Because, you know, nurses know, like I know as a nurse, I know when a patient's getting ready to, like, you know, eject from the bed, right? They get restless. There's certain things that happen before that. But this is actually computer vision that's been trained. So that's just one example for the falls, utilizing computer vision. And then, you know, there's a lot of things like virtual nursing, virtual sitter is one. And the virtual sitters, they actually, the models have built in those things for computer vision, right? Because they're watching the patient. And but the alert would go to the virtual sitter to let the nurse know, or to let the virtual sitter know to key into the room to say, Mr. Smith, someone's going to be right in. And sometimes just that verbal to the patient can kind of break that restlessness and stop it in enough time that they wouldn't try to get out of bed without assistance.
Thank you so much. So with that, there are a number of concerns that are coming through the chat. So I just want to basically group them all together rather than answering specifics or requesting to answer specifics. And that is, what are there are great benefits that you're mentioning, but what are some of the risks that AI poses to healthcare, and how can we ameliorate those risks? Whoever wants to start.
So I'll jump in. Obviously, we've touched on it a little bit, but bias and discrimination, in particularly in healthcare allocation and in triage, lots of the AI tools to date have based their predictions of healthcare need on what people have spent on healthcare costs in the past. And particularly for racialized groups, that's a terrible, terrible measure, because those groups may not have the same access to healthcare that, say, white people do. So they may not be able to get the same amount of time off from work. They may not be able to get childcare. They may not have a doctor or a hospital in their neighborhood. So those algorithms tend to under-predict the needs of racialized populations. I worry about over-reliance on algorithms and the de-skilling of people, because if we become entirely too reliant on these tools, we won't have people training in radiology. We won't have nurses that have the empathy to hold somebody's hand. We'll just send in a robot at the end. And obviously data privacy and security is a huge issue, that if we're going to be crunching all this patient data, we have to make sure it is absolutely secure and can't be de-anonymized.
Wonderful. And next over to Michael. What do you see could be some of the risks, and how can we get ahead of those?
I'm going to go back to 2 points I made earlier, which is the importance of creating a governance structure for oversight. I cannot express the importance of having a designated body of experts looking for ways in which algorithms can go awry, and working with development teams and auditing and correcting those issues. I think that's incredibly important. The other thing I think that is very important is the fact that the education for this new workforce is non-existent, right? So it's not in the essentials. These types of things are incredibly concerning to health systems and to physicians and to others, because the accountability has to stay with some body or some organization or a discipline. So there's a lot of pushback right now around who has that accountability. Where does that lie? And where does the training exist to help clinicians understand where bias can potentially creep up? There's a really great position statement by ANA on the ethical use of AI, and I'll put that in the chat for you all.
Thank you.
But ANA is positioning themselves, is suggesting that nurses need to understand the different types of bias that can creep within an algorithm. Nurses need to understand how to engage in rigorous research and evaluation of these algorithms. So that is where I'm spending a lot of my waking hours thinking about, particularly within our school of nursing.
Wonderful, thank you. And Kathleen, do you have anything to add to that?
I got to double click on Michael's, the essentials, right? The scope and standards of, we don't really, for nursing informatics, right? We don't have, there's no nursing informatics in undergrad, right, for nursing. And there's a lot of technology that the nurses, that are coming out that have to adopt. And part of it is it's not in their curriculum. There's not a lot of time for it, right? Where are they going to put it? There's so many clinical streaming, other things that are such priorities. And then what I hear from, even from, nurses with experience, there's so much technology I need to learn when I get to the bedside. I just want to do patient care, but there's all this tech. It's not just AI, right? So, but if you think about all the technology, it's smart pumps in the beds and the ventilators, they all have AI built in. So you really need to be able to comprehend that. I think one of my concerns is that we need to really cultivate critical thinking and analytical skills. And I want to make sure that we don't lose that, because people think, oh, AI is just going to come in and, think for us. That's not really what it's supposed to do. To Maura's point earlier, it's really to be adjunctive and assistive to us. And then I do worry that there's going to be disparities in adoption across, health systems. Some health systems will bring it in and do really well. And there's others that, may be laggards, and it's not going to be really fair to the patients or to the staff. So how do we make sure that it's equitable and everybody gets the opportunity to utilize the technology that's available?
I'm so glad you mentioned that, because that leads me to the next question. And I'm just kind of looking at a whole bunch of questions that came in from the chat, and they're concerned with finances. So what do we do about hospitals who maybe are in a less financially prosperous situation that, and we're talking about health equity and social determinants of health and access to affordable healthcare, but these institutions that may be lagging behind in terms of their financial ability, what will happen to them? How will this affect reimbursement? Will it become more efficient? Will it save us as consumers, taxpayers, money? How will it affect hospital budgets? So just from a financial perspective, anything that I mentioned or anything else that comes to mind for the financial bottom line, how do you think that will be impacted by AI?
I think AI is going to crack down on fraud because it is going to be able to find the fraudulent stuff through pattern recognition much easier. So I guess that will be helpful financially.
Okay, wonderful.
I think one thing is we're so early on in this, the AI in general, that especially with the speed to generative AI, right? Within 2 months, it had 100 million users. It's crazy. I think it's to be determined. There is a cost associated with implementing any new technology. Some organizations might be faster, starters. Others might sit back and see what's going to happen. But I don't know, honestly, Keith, if we really have here's the dollars that it could potentially save you, or here's the dollars you could recoup, leveraging AI. I think that's part of reticence maybe for organizations that, are thinking about that investment, but aren't 100% sure they should make that investment.
Wonderful. Thank you very much. And Michael, just anything that you could think of, I would be very interested in your opinion on the financial impact, whether a detriment or a net positive. What do you think?
I definitely think that is a huge concern because, and again, I'll just use the example of Duke. While the infrastructure is in place here, there are lots of rural, smaller community hospitals that exist around Duke that will likely not have the infrastructure, likely not have the expertise to utilize a lot of these different technologies. So I think it will be a cost to them to try to access and try to train their staff in a way that they can utilize these technologies to support patient care.
Okay,
What that cost
wonderful.
will look like, Keith, I'm not sure.
If only we had AI predictive modeling to let us know. So thank you very much for that. So one other question, just bottling up again, looking at themes. People are talking about education. So I heard somebody wrote, oh, great, another certification, or we're going to miss out for those of us that have already graduated. So what changes do you think might be necessary in nursing education? And that could be the undergraduate, graduate, or on-the-job training. But what changes might be necessary to prepare future nurses for a healthcare landscape increasingly influenced by AI technology? And the second part of that is, how may training be enhanced and education be enhanced by AI?
You want to go first, Michael?
Yeah, I think, thanks, Kathleen. I think that educators, we will have to provide a variety of educational formats. I think that creating traditional programs of education, a certification, a master's program, a master's track specialty, I think we'll get to that point. But I also think that we will have to figure out a way of delivering content to a variety of different users. So how do you provide online asynchronous training modules for the working professional that wants to upskill, if you will, but not necessarily invest a year or two in time or financial debt? So I think it's going to be incumbent upon us as educators to figure out providing these different formats for multiple users.
And I think we're going to see, when many of us went to school, people of my age, maybe Kathleen's age, Michael's age, you went once and done. You got your degree, you got your licenses, and you went off and you practiced. And I think those days may be over. We may have moved into micro credentialing because the technology is moving so fast. Even if you learn it this year, 3 years from now, that may be all superseded. So I think we're going to have micro credentials that people will throughout their career go in and out of coursework, whether it's online and offered by programs like Michael's or otherwise. I think that's the wave of the future.
Wonderful.
I also think that we'll see potentially a lot more simulation because it'll get better because of the AI, as well as the ability to leverage virtual reality or augmented reality for situations that involve clinical care. But I work with a lot of educational universities, large universities affiliated with academic medical centers, and they are very much concerned about how do we include information technology across the curriculum of nursing earlier. But one of the drawbacks is you've got to have educators that can do that curriculum, right? And they're not necessarily the educators available. I mean, if you think about a nursing curriculum in general, there may not be a data scientist in that group, right, of academics. So how do you pull in the appropriate resources to be able to do that type of education? But there's such a crossover into information technology with nursing now. I mentioned all the different technologies that they use. And it might change a little bit because you have to look at the student population. I mean, nursing is, you spoke about workforce nursing. If you think about it, it is, from people in their 20s to their 70s. So there's 5 decades they have to cover within that, span and how they utilize technology. And I'm hearing from organizations that anywhere from 50 to 70% of their staff is Gen Z, which means they're 25 or younger, and they're technology natives.
And if you deal with younger people as I do, encourage them to be interdisciplinary, to learn computer science or tech and nursing, because the number of people who speak both languages, you can sort of count on one hand. I'm a technologist in the area of law. I do some work in health, but you need people who have a background in both, because it's very hard for me to design and develop programs that will be actually useful to nursing people if I know nothing about nursing. And obviously nurses who know nothing about technology, that's not helpful either. So we need young people coming up who are trained in both areas.
Wonderful. Wonderful. Thank you very much. So another common theme that's emerging is, where can I learn about this? So we all know ChatGPT and Bard, now Gemini, those are becoming household names. But for those who are interested in getting a jump start, or perhaps they want to get involved, as Michael mentioned, from a sort of a policy kind of standpoint, or from an interest, or be able to get some of those skills or enhance their knowledge, where would you recommend that our audience members go to for more information or to get a jump start? Either specific or general, anybody.
Yeah, so I always recommend like the ANA, to Michael's point, right? They have put out some position papers, and I do know they are working with AI experts, advisors, because they realize this is very important. And ANA, actually, for those that don't know, have a whole innovation center. And they're also, the American Nurses Foundation. So it's a very large organization. And then I consider other organizations as well, right? The American Nursing Informatics Association, as well as FHIMSS. So there's a lot of different NYAM, the New York National Academy of Medicine, there's a ton there as well. I've gone on the website myself and seen many a great webinar that I could go in, or a podcast I could listen to. So I think a lot of it is, self-service education. What are you interested in learning more about? And then just understanding the different organizations potentially, and then use it. I was on a call with someone earlier today, and they were like, you have to use the tools in order to understand it. So get a free account of ChatGPT, and it's 3.5, which is not the latest version, it's 4.0, but you can still use it and you can learn a lot. And I actually did a session where we asked the attendees coming in to, download the ChatGPT app, and then we gave them go into ChatGPT and ask it, write a nursing care plan, and then expand on that, writing a nursing care plan for an African American male with diabetes, or you know what I mean? So the more the fact that you're using the tool gets you more comfortable with it, and you can speak to it.
I agree with that, and I think a lot of these vendors who are putting out the tools, OpenAI, I'm quite certain, Microsoft, Amazon, and others, they have general educational videos. They won't specifically train you as to nursing, but at least get an understanding of the technology in general and how it works and its strengths and weaknesses. And I agree with Kathleen. Go play with, there are lots of them that are free that are out there that you can play with and see what it can do and see where it hallucinates and really goes off the reservation. And that's the best way to get comfortable with them.
Okay, wonderful. Thank you. And Michael, where do you see this in terms of education?
So a couple of things I would say.
Sorry.
So there to Maura's point, there are a lot of opportunities for people to learn more about these different technologies at a national level. There are fewer in opportunities that are tailored specifically to nurses. And so that's what we're really focused on, is trying to develop training resources for nurses in particular. One of the things I'll say is in a lot of free opportunities exist with that different universities. For example, Duke AI Health, we have a lot of learning opportunities where people can access our events for free and can participate, such as opportunities like this on an online format, and learn more about the different technologies that are being used at Duke and across the country as it relates to AI technology. So I put that link in the chat. And if I'm not mistaken, all of those opportunities are free and accessible to anyone.
Wonderful. Thank you very much for mentioning that, because one of the questions that came up is this only for nurses? And of course, nurses make up the largest body of healthcare professionals, but by no means are we nurse specific. So we have 13 minutes left. So I don't want to miss the opportunity to ask something open-ended of each of you. Is there anything that you would like to convey to the audience that hasn't been brought up before regarding AI? So I just wanted to give some sort of open-ended opportunity for you to address any burning issues or anything that you'd like to present to our audience.
I would just like to leave the audience with this consideration. This technology has the potential to really impact and change healthcare in a significant way. And my concern as a nurse is that the rocket ship has taken off and we're not on it. We need to be involved. We need to be at the table having these discussions with development teams, with technology companies. As schools of nursing, we need to start to build the curriculum so that we are responsible in preparing the next generation of clinicians in utilizing these technologies. I think that's our charge, and that's something that we really need to galvanize around.
Wonderful. Thank you. And perhaps, Maura, is there anything that you'd like to tell our audience that hasn't been covered as of yet? Any burning issues?
Sure. So AI is not inherently good or inherently bad. It's a tool like fire or electricity. It doesn't have inherent qualities. What is going to matter is how we use it and the safeguards and the guardrails we put around it. And that's where we really need to watch out to make sure that there aren't the same structural disparities and discrimination that there's always been for any resources. We don't want this stuff concentrated in the hands of a few big tech companies with no regulation. That is just, sorry about that, Kathleen, but
That's okay. I agree.
sorry that it's that's just not a safe approach moving forward. And don't feel like you're powerless. Get yourself on a committee if there is a committee at your hospital or your facility that is going to look into AI tools and decide which ones to adopt, for your facility or your hospital or your unit. Get yourself involved in that. So, and speak up, be at the table. I think that's just critically important.
Wonderful. And Kathleen, is there any burning issues or anything that you'd like to tell our audience about AI that hasn't been covered as of yet?
I think Maura and Michael really, stated it very well. I think that we can have a seat at the table, but we need to be able to be articulate and understand the problems that we're trying to solve. And we can't, I agree with you, Maura, right? We're not going to come in as big tech and tell you what to do. We really need that feedback from the end users to understand what true problems we're trying to solve. So I'm all about problems and solutions. I will say I went into informatics because I was told some guys in the basement built this program that we're using. And I was like, well, how? They didn't know what our workflow was. And so that was my goal, really, right? So really have the seat at the table, being able to articulate what our workflows are and what our needs are. And ultimately, I think AI could be a piece. It's people, process, and technology, right, Keith? But it could be a piece of bringing joy back to our clinical providers, especially our nurses, to the care that they're doing.
Wonderful, wonderful, thank you. And by the way, our participants, our audience members have been putting in many suggestions for you. So we'll try to take all of your suggestions down and deliver them to each of you. Things like we don't want AI answering our phones, holding hands for patients, which you've already mentioned, and a number of other things. So thank you very much. So the next question that I want to ask is because there is some resistance to AI, and so how do we foster adoption or in some cases acceptance if it's thrust upon them, given the concerns about employment, malpractice lawsuits, and potentially other detrimental factors, not the least of which is fear that patients and providers may have of AI? How can we foster adoption and acceptance, please?
Well, I think education is key, and talking to your staff, right? Talking to your coworkers, your employees. To me, much of it is around education. I did do a speaking event with about 660 nurses, and we asked them, what word would you use to describe AI? They were all bedside care nurses, by the way, hands-on nurses, and all the words what you would expect: anxious, scared, worried, concerned. But they were all in an event that was talking about AI all day. So in my mind, that was the first thing we asked them, was tell us that one word. So the goal would be to kind of change those worries and those words that are all worried and concerned and anxious, to kind of have a better, outcome as far as worried, but I'm willing to learn about it, right? That's different. Or concerned, but I see the potential to help and I want to contribute.
Wonderful, wonderful, thank you. And Maura, what are some ways that we can get past these concerns?
Well, I think, as I said earlier, this really isn't a choice.
Right.
This tsunami is coming, whether you like it or not. So, if you know something is coming your way, the best thing you can do is get familiar with it. And like Kathleen said, try to get around your fears and figure out the ways it can be useful. And knowledge is power. So get knowledge, get yourself involved, but don't stick your head in the sand and avoid this, because unless you're very close to retirement, you're not going to be able to avoid this.
Okay, those are sound words. Thank you so much for that. And Michael, I just want to add one thing before I pose the very same question to you. I'm seeing two different things in the chat that are diametrically opposed. One is we thought that electronic health records were going to take away work from us, and it didn't. So they're worried that there's going to be too much of a burden. They're also worried that we're going to be replaced, yet we want less work to do. So some feel that it's going to take away work. Some feel it's going to add work. It's going to replace us. It's going to make us do more. So how would you handle that paradigm, in addition to everything else, to be able to foster adoption and acceptance?
Wow, that's a hard question, Keith. So
Sorry about that. I couldn't help myself.
So I would say, and this goes back to a point that Maura made earlier, which is I don't see AI replacing nurses. I see it enhancing our capabilities. I see it, to Kathleen's point, providing and freeing up opportunities for us to engage with patients in greater volume. And I think that is a good thing. But there is the issue of buy-in, right? And that's very real, in the concern of fear. And I'll make this suggestion, particularly in health systems. So, I mean, not health systems, in schools or nursing. So one of the ways that you can begin to engage is to engage like nurses always do. What is our baseline assessment? What do your nurses know? What do they not know about AI? What are the challenges that they perceive? What are the barriers that they perceived? What are the advantages that they perceive? We did this a couple months ago, and it yielded a lot of great information for us to have a robust conversation within our faculty governance retreat. And that really opened up the opportunity to kind of share that information with the entire faculty around where the concerns are, where the barriers are, where are the recommendations for potential next steps, and where are the types of supports that you would like to receive to enhance your understanding of these technologies. And so we did a series of breakouts in polling softwares. We utilized a few use cases in research and in teaching, and had faculty, based on their own judgment, identify where they think the greatest impact in these use cases are. So they voted on those use cases. And so those use cases provided the action steps for us to now begin to develop the supports around their concerns.
Okay, wonderful, wonderful. Thank you very much. We only have a few short minutes left. I'm going to pop in the feedback form in the chat, and if I can get that. Pardon me, while we experience technical difficulties, please stand by. Okay, so I just submitted the feedback form. So we only have a few minutes left. I was just wondering, we already asked if there was anything open-ended that you wish to discuss, but can we have any final thoughts? And then we'll go to Allison, who will give us our final remarks. Any final thoughts?
Trust but verify.
Thank you. Wonderful. Kathleen, any final thoughts?
That's very good. That's a very good one. I would say that, just attending this webinar or listening to this webinar, for listening after the fact, it's a good first step. Mm-hmm. There's still a lot for all of us to learn. We're all in it together. And I think, as nurses, we're all comrades in arms, and we have to help each other.
Wonderful. And Michael, any final thoughts?
I think I would echo what my colleague said. We are in this together. You're not struggling or have any concerns or fears that are different from other universities or health systems. There are a lot of faculty and clinicians that are experiencing the exact same thing. And we're having these incredible listening sessions like this, trying to figure out next steps.
Wonderful, wonderful. I can't thank you all enough. Now, I don't want to steal Allison's thunder, but I just want to give some quick closing remarks. Thank you, everybody, organizers, Malloy University, panelists. I put the feedback form in the chat. You have about 1 week for those nurses who want CEUs. Please fill that within 1 week. And also for those of you who are non-nurses, we still appreciate your feedback. We ask you to join the NYAM mailing list from the website so you can learn about other events. And just a special thanks to our audience members. And my apologies, we could not possibly get to every single question, but we will try to take a copy of this, send this to all our esteemed panelists. And everybody's asking about a recording, and I understand from NYAM A recording is being made, and we will make it available to you on the NYAM YouTube channel. With that, as we say in Congress, I yield the remainder of my time, and I'll turn it over to Allison.
Hi, everyone. Thank you very much for attending today. Thank you to our panelists for a really great facilitated presentation and discussion. I'm Allison Squires. I'm the chair of the New York Academy of Medicine Nursing section. And just a few closing thoughts to anyone who's a frontline nurse attending this. Don't forget, you can always send feedback if you don't have the time to participate on a hospital committee or your organization's committee, whether you're a home health nurse, you're out in the community taking care of people in different places. Make sure that you send feedback about the issues that you're seeing in the field. You know, people can't fix the problems if we don't know it. But if you really want to get more involved, that is the key. We need to be, as Michael said, make sure that we are on that rocket ship and that we're the ones who are using technology the most when it comes to what we're seeing in our workplace. And, you know, this really has the potential, I agree, to make our lives easier, but we need to make sure that we're there helping to make sure that it makes our lives easier. Because, you know, we clearly, no healthcare provider was around when they were designing the electronic health record, let's be real. But we want to make sure that we can learn from those, shall we say, challenges that have arisen from past practices, but also go out there, get educated, find programs that, you know, where you can do an informatics certificate. And, you know, and make sure that it's interdisciplinary. The best programs are interdisciplinary. They're not housed in a single silo. Because if the nurses and the engineers and the data scientists and the researchers and everybody else on the healthcare team are talking to each other, then we're going to have better systems overall. So thank you very much.
Sorry, I think we forgot to acknowledge Ann Kurth. So I just wanted to acknowledge her
yes.
for supporting this program and for actually giving us the idea for the topic and for this program. So I just wanted to say thank you, Ann.
With that, I'd like to thank everybody for a wonderful event, New York Academy of Medicine, everybody who put this together, Malloy University, and of course our lovely audience. Be good to yourselves and each other. Have a wonderful night. Take care. Goodbye.
Thank you, everyone.